Today is about what's the future trends going to look like around what are the issues that are affecting us in society, in family, in community, into the future, and then what effect will that have on substance misuse? So I have been told that those who try and predict the future will invariably get it wrong. And so they're made to look like a fool. You know, we've heard about this before. Nokia said a phone is a phone. IBM said these personal computer things won't work. So people have predicted these things in the past and it's never necessarily come true. So I'm not going to try and predict, though it's really easy to fall into that, but it's more about let's look at the trends, let's look at what's happening today, and then look at the trends over what do we think may happen, what are some of the possibilities. I won't be able to cover everything, so and I have a short period of time, so hopefully it'll start us thinking about different ways of approaching. So I just wanted to show this picture because I do a lot of presentations, and we at the ADF sort of say, you know, drug taking will always be with us. It has been for 2,500 years. You know, marijuana was found in a tomb. Drugs have been used by different cultures for different reasons all the way throughout the centuries. There is something about us that we like to change those chemical compounds in our brain, and we want to do things like that, whether it's legal drugs or illegal drugs. So, and we're all drug takers, whether it's illegal or legal. And so we need to be mindful of that. So what we do know, and I'm not really going to spend a lot of time talking about alcohol because yesterday we had a lot about licensing, and I think we know a bit about alcohol. But what we do know is cannabis is our second favourite drug of choice in terms of the population who are taking that drug. On around 9 to 10% are regular users of cannabis of the population. We're seeing a rising concern around anabolic steroids, and some of you were in the AOD presentation yesterday. This will be a reminder of what we talked about yesterday. But we're hearing anecdotally about young boys, young men, 15 years of age, taking steroids, anabolic steroids, because it's about body image. Bigorexia, they're sort of calling it. We've got to have a name for everything. It's not an epidemic, it's not a pandemic, but it's, you know, it is something that we've got to watch. And we don't know enough about this because they don't think of themselves as users of drugs, so they don't answer the same questions that users of drugs will answer. So it's really quite disturbing in the sense of this is something that is sort of creeping into our society about this. The other one is around pharmaceutical misuse. Now this is overuse or misuse. There's two different categories around this, but we've now got a lot more people dying from overdoses of benzodiazepines or opioids like oxycodone or endone, or over-the-counter codeine. And so this is quite alarming to us because here's a legitimate drug that's given to us, prescribed to us by a professional. And this is given to us for the main reasons of pain, anxiety and stress, and insomnia. And they're the three leading causes of why people are taking these pharmaceuticals. Now, they're either overusing them, taking far too many, they're mixing them with other drugs, they're lending them to each other and may not understand that that's misuse, or they're deliberately doctor shopping to actually get high from these chemical compounds. So this is another area that we're seeing an increase on. More people dying from overdoses of pharmaceutical drugs compared to illegal drugs of overdoses. New psychoactive substances have been around now for about 4 or 5 years. They're quite concerning to us because how they started off of mimicking one drug and the process that they do to keep changing that drug so it's just slightly every bit ahead of the law is they keep changing the chemical compound. By now we're at the 6th generation or 7th generation away from what it was mimicking. And so we don't know what these drugs are, and they're quite toxic. A lot seem to be bought over the internet. We are now seeing a couple of deaths happening once or twice a year because these people are either taking too much of this drug or it's quite toxic. And the other one I've got there is, I think you say Nootropics. And this has sort of been getting a bit of airplay lately, and you probably know this more as smart drugs, cognitive enhancers. My TV says it's smart. I think we both have a different definition of what that means. But the thing is that cognitive enhancers, there's a lot of studies around that it's not as big as everyone's making it out to be, that students are taking Ritalin or no-dose or something, or modafinil, to focus their attention when they don't need to take these drugs. There's a lot of research being done in Alzheimer's that is actually talking about cognitive enhancers that will focus and maybe increase your brain capacity. Think about that. Who wouldn't take that drug, you know? But let's remember, drugs have good sides and bad sides, so it's quite interesting. So that's in the sense of what we know. And of course, with alcohol, still the major drug, 5,500 people die from it a year, 157,000 people are hospitalised because of alcohol. So it is still quite a concern. So if we look at the global drug trends from United Nations, and what we're seeing is when we look at illegal substances, is we're seeing an increase in use. This is across the globe. Now in Australia it's been steadily sitting at the same level for the last 10 years. It hasn't really gone up or down in the last 10 years, it's pretty well stayed the same. But around the world we're seeing an increase. And this is quite interesting because at the same time around the world we are seeing a global downward use of alcohol, and even in Australia, and nobody can explain why that is happening. And I was at APSAT on Monday or Tuesday, and the question was raised there. They still don't 100% know why is there a global trend down. Now, we can all congratulate ourselves and put our hands up and claim that we have been part of that. And the younger generation have had bad role models from the baby boomers and the X generation. So there's been maybe they've learnt what not to do by some bad examples. But it's quite interesting that we have a global trend going up of substance misuse. Now, we also know why people get into a misuse or an overuse situation. We know the factors that affect that. Now, not one of those factors, but multiple of those factors, those risk factors, can lead us into a misuse environment. And it's those that I want to explore through this presentation. And I want to do that through what we call the social determinants of health. You would have heard about this. I don't know how many have had listened to Michael Marmot's Boyer lectures that were on recently with ABC. We talk about a lot about this in population health. I went to the 12th annual Global Health conference a week ago in Melbourne, and they were saying we have to go back to the social determinants of health. They've sort of forgotten it. And I'll talk a bit more about that. But what these do, these are the factors that can influence us. The society. What are the beliefs? What are the drug laws? What are the things that are happening there? And then we have community. How easy is it to get drugs? Where are they from? The amenity, the local licensing. We have also the family. What sort of relationships? What's our education level? Our income level? What's our role modelling? What behaviours are we setting within that family? And of course then there's the individual. What sort of temperament is that person? What's their level of education? What's their role models? All of these factors play in the terms of how something will happen in terms of misuse. So I thought let's go through each of these and have a discussion about this in terms of trends. So with society, I sort of wanted to look at things like there's this rise of nationalism, loss of power. I want to talk a little bit about drug laws, big business, and whatever happened to the common good. And I heard people talking about that yesterday, about the common good. So, the rise of neoliberals. Brexit is another example. Pauline Hanson. All of these people that are, the Tea Party, Trump. All of these things are playing out across the world in terms of the neoliberals believe in free markets, very little government involvement, in fact, minimal government involvement, very much about individual rights, as long as you don't do harm to others. So if I want to, all drugs should be made legal. I should be able to smoke or drink or do whatever I like as long as I don't hurt someone else. But they also believe that you have to pay for your own education, you have to pay for your own health. So if you choose to do this, then you pay for your own health. So there is no common good. It's about the rights of the individual, not the collective. So this is playing out across the world. Brexit has seen us look at this whole idea of sort of loss of power among us, the plebiscite, and that we need to look to, we need to tell the government that they can't rule us, the ruling class. But it's also about that fact of sort of coming isolationist again. Maybe it's a backlash around, globalisation, those sorts of things. But there is this innate sense. And Trump, the people who are following Trump, are following because he says the things, he doesn't necessarily act them, but he says the things that they are saying and they want to hear. So it's really quite interesting. Our jobs go offshore with free trade agreements and various other things. We have trans-Pacific partnerships that are discussed in camera and nobody knows what's involved in them. And big business is there, but the people aren't. So we're starting to have a mistrust with government. We're questioning scientists. We're saying climate change doesn't exist. They've got it wrong. We're starting to question all of these authorities. And it's, it may not be you, but in general, this is what's happening across the world and also across Australia. There's a very big debate going on about inequality. And this has come about since, the global financial crisis. We were pretty well equal in Australia in terms of equity was quite narrow. And a man named Richard Wilkinson wrote a book called The Spirit Level. And it's all about those countries that have a wider gap between the rich and the poor actually have greater health issues and have greater problems in their society. Those that have a narrow gap actually have less. Denmark, Norway, Scandinavian countries. The world's most happiest country in the world, according to the happiness index, Denmark. So all of these sorts of things are sort of saying, so Wilkinson's theory is that the bigger the gap, the greater the problems. Now we're not when we're talking about inequality, we're not actually saying we all get paid the same. People will be paid different amounts. But if those people who are at the highest end are further and further away, so what are we saying? That the top 10% of wealth is owned by, the top 10% hold 45% of the wealth. And the GFC saw that nothing changed for those people at the top end. In fact, they got richer. And we have stayed lower, or some of us have stayed below the poverty line. And so when we have a wider gap, the question is those at one end become totally divorced with those at the other end. And there's no empathy. There's no connection. In fact, there's a disconnection, which says, well, they just need to work harder. They need to get a job. What's wrong with them? It's their fault that they overdosed on drugs. And so they have a disconnect from that. The common good goes. So inequality is a big issue. We also have things like drug laws and those various things. We have a group of people who are sort of saying now we need to legalise all drugs because that's the simplest answer. What's the complex problem we're dealing with? Let's have a simple answer to it. Let's legalise all drugs. That's simple. But when we ask people around this in the national drug household, they're not very comfortable about legalising all drugs. They may look at cannabis, but they're not necessarily comfortable about legalising heroin. So the members of our community can distinguish between the differences between drugs. So we've got drug laws like decriminalisation, we've got drug laws around medicinal cannabis, and I'll come back to that. And we don't necessarily have a zero tolerance in Australia, but other countries do. So here's a map of the differences across the world of different drug laws. And you can see with the blue, this is legal or essentially legal. So we've got Colorado, Washington, Alaska, some little country there. I didn't know there was a little country there. And so we've got that this is legal. So we've now got in Colorado that it's legal to purchase and smoke. It's legal to grow a certain number of plants. 7 plants, you can do this. And you can also, there is no restrictions around, there's no conditions in terms of this. You can have a chocolate bar that's got 17 joints in it. I could eat a whole chocolate bar. I would never smoke 17 joints. So it's really quite interesting. We also have gummy bears. We have a whole range of different things to do with this. But then we also have, now it was orange, but this screen is gone a bit greeny. So then we have that it's illegal but decriminalised. And the light red, which is Russia, and that is illegal but often unenforced. And I think they've got here in New South Wales, we have illegal but decriminalised. And a lot of states in Australia probably have diversion or try and say, well, if they catch someone with cannabis, then it's different. But this is around cannabis and what's happening across the globe. And we in Australia are now looking at medicinal cannabis. And where about 69% of the population support medicinal cannabis. In the States, medicinal cannabis was completely different to the way we're going to operate this. And last Tuesday, the federal government declared that cannabis is no longer a Schedule 8, is now a Schedule 4, and that people can apply to grow cannabis plants for the production of medicinal cannabis. Now, it's going to take some time. To me, it's a short crop, cannabis. I don't think it took that long, but it's going to take us 15 years once we do all the tests for actually medicinal cannabis to probably be out there. So we need to do a whole lot of testing. And it's interesting around medicinal cannabis. We don't have a lot of evidence around its effectiveness. We have a lot of anecdotal evidence from everybody who swears by it that this is really good. So we're going to make it legal for things like epilepsy and those sorts of things. Yet the majority of people who are now using medicinal cannabis, whether legally or legally, is for pain and anxiety. Not what we're making medicinal cannabis available for. So that's going to be quite interesting. We also see that the majority of people who are using medicinal cannabis are in their 20s. And Wayne Hall from the University of Queensland did a paper a number of years ago where he looked at California and their medicinal cannabis, and the majority of people in California were in their 20s. So he was thinking, do they really need medicinal cannabis in their 20s? You know, that there was a whole lot of them. It sort of didn't seem right. But he just thought it was a pseudo-way into legal cannabis. Now, I'm not saying this is the case in Australia. In fact, it's completely different. And let's not think it is the same. It's completely different. Medicinal cannabis will be low THC Cannabis comes with a whole range of different things, but our medicinal cannabis will be low THC. But there's so many compounds in cannabis that we don't know what it does, so there's a whole lot of research around that. But I am really pleased that the government will control the growing, will control the production. It will not be smoked. It will either be it will probably most likely be a pill. Though the other piece of research that's been done is those who are giving their children this oil, and you've seen all these pleading stories about this, the majority of those people smoke cannabis. So they're parents who smoke cannabis, and they're giving their child the oil because they believe that this is what solves it. So we have a group of people over here who are doing their own evidence around medical cannabis, but we haven't got the evidence around this from a clinical perspective. So it's actually going to be quite interesting as we watch that. So let's look a little bit, so that's about society. Let's look a little bit about community. And I think you all would relate to this. Majority of people don't feel safe anymore. So the ANU did a poll where 50% of us believe we are a target of terrorism. I don't know how you feel about that, whether you feel that we are too. Are you part of that 50%? But we do feel less safe. Now, I'm on a community group that's looking at safety. It's a World Health Organisation's community safety program, and they did surveys of their community and they found out what is it that people don't feel safe about. And really, I could have been reading the front page of the Daily Mirror because it's really what the perception was, not the reality. In fact, we're the safest we've ever been, from health issues, from a whole range of things, from personal issues. We're the safest we have ever been. Yet our perceptions are we feel more unsafe than ever before. So is there more of a disconnect between us and what's happening in the world? And the real issue I thought was funny with this group that I'm on in the outer suburbs of Melbourne is one of the key ones was about online safety, which actually that threw a curveball to me. But that was one of the things that they were feeling very insecure about. So it's interesting around that as well. The internet, love it, hate it, doesn't work, works. This has really changed the game. This is now about availability of drugs. You can buy anything you want on the dark net. You just got to know how to get in it. Can I also tell you can pretty well buy anything you want on they're now calling it the surface net, the surface web, so on the internet. And I'll tell you later how to do that. But the thing is that the internet has changed. So we shut down Silk Road. Guess what? Silk Road 2 appeared. Sounds a bit like new psychoactive substances. We get rid of one drug and another one appears. We now have a myriad of drugs. And NDARC, the National Drug and Alcohol Research Centre, monitors these in the dark web, and they actually look at these and look at what are people purchasing and what's being done. So there's quite a few. There's always 3 major ones that are always in play. And in terms of delivery of drugs, they either come from overseas or they come from within Australia. But the top 3 drugs are cannabis, MDA and pharmaceuticals. Not sure necessarily of the provenance around those, but they're the top 3 drugs that are purchased. And the other thing around that is also that in terms of so it mimics what's being bought in the street markets. But there's another potential danger here, and that's the potential for dealing. So you can go into the darknet and buy, I'll pick a number, 100,000 pills for 20 cents a pill, and then you can sell it for $80 a pill. So there is a potential there that dealing could happen, that you can make some money around this. So the internet has really changed the way people can get drugs. Silk Road used to have a valuable resource as in harm reduction advice around drugs, but new marketplaces don't have that. And they would actually share information, say, I got that batch of the drugs and that was bad, don't touch that. So very much around that harm reduction. That sort of disappeared from that. But to me, the internet has changed the way we get drugs. And that may then change our attitude towards drugs as well. So let's have a look at family. So income is really important. We talked about inequality before. Disconnection, the risk factors are around education levels, I'll talk about that, but also is about employment. It's about self-worth. How do we fit into society and contribute to society? So what we've seen, what is interesting, is that our unemployment is falling. So that's what they'll tell us. But what's happening is part-time work is increasing and full-time work is decreasing. So we don't necessarily have people in full-time jobs anymore. We have a lot more in part-time work. And this is not that they want part-time work, but that's what's available. We also have a casualisation of the workforce, where they're more working on a casual basis than they are being worked on a full-time basis. So that has some impacts about security. Oh, golly. 10 minutes to go. Okay, that's about security and those sorts of things. So let's keep moving. I put this up for a bit of fun, but it's not probably very fun. But this came from the news.com because they're, got a lot of evidence. They called it the hopelessness index, just so you feel worse. So this is around not necessarily about... This is about the rates of unemployed people in comparison to the number of jobs that are being advertised within a 12-month period. So if you live in the Northern Territory, you're doing really well. But if you're in Tasmania, this is really hopeless. So this is what this news poll's telling you. So they want you to feel good. So New South Wales, here you are. Not so hopeless, but getting there. So you feel better? All right, let's have a look at levels of education. I want to go through this really quickly. This is New South Wales. So this is around majority of people. This is 2006 is the white and the brown is 2011. So there has been an increase in terms of the number of people at different levels. This is postgraduate, this is year 11 and below. But the majority of our population get to year 11 and below. A smaller number get to a postgraduate degree, and here's our bachelor. So that's not too bad. That's quite good. So then I wanted to look at a couple of other things here. And one of those is that what's the rate of... Because disconnection from school and education is a risk factor that we need to be mindful of. And so... over 5 years in New South Wales, the suspensions from school with suspended kids has risen by 36%. So that's quite remarkable. I need to keep moving. This is a report that was done in Victoria. Couldn't find one for New South Wales. It was done by the Youth Advisory Council. And this looked at what happened when kids were on suspension. I think the same would play out here. 72% said the problem wasn't resolved when they went back to school. In fact, they felt the teachers disconnected from them further. 23% did their schoolwork, but the rest basically played Xbox. So it's a pretty good day. And 59% said their teachers did not help them to catch up. Now, I did a presentation to teachers 2 weeks ago, and I showed this. They are influences on people. They can make a difference. But if we suspend kids or expel kids, we need to also help them work out why and help them through that process of what that is. There's potential greater risks. The global burden of disease looks at things like death, mortality and those sorts of things. There are now a few people who are saying we should change the way we look at the world burden of disease in terms of no longer about deaths but about disability. And what they're seeing is, because infant mortality was very high in the world, what they're seeing now is a rise of non-communicable diseases like back pain and mental health problems. Doesn't that tie in? Do you hear the same thing repeating over again? Stress, anxiety, mental health, back pains, insomnia, all these things keep repeating. And let's not forget my favourite topic. We talk about the social determinants of health. What about the ecological determinants of health? Because climate change will affect how we get food, how we will get access to clean water. Now, it may not affect us right now, but it's going to affect the populations across the world. There's a whole lot of things involved in that. Canadian Public Health Association put out a great book called Addressing the Ecological Determinants of Health. Well, it's not a book, it's a report. And it's fantastic and you should read it. So my question to you is, how far upstream do we want to go with all of these sorts of trends happening? It's a bit doom and gloom, isn't it? Do you feel a bit stressed? How's your back? Getting there? So, this is Julie Ray's version of what we should do. We should have more government intervention, more family support. In Norway, they have a program. This is beyond maternal and child health. They come in 6 months before the baby's due and they stay till 5 years of age. Now, they don't live with you, but they're constantly there having conversations with you and helping you about role modelling. For those of you who heard me yesterday, children as young as 4 can tell the shape of a bottle of alcohol, can tell what an alcohol is by the shape of its bottle. Children as young as 6 can tell it by the smell. So therefore, what are we doing in those early stages? We want to increase our education levels. Let's get that figure higher. Let's get kids staying in schools. We need to increase our health literacy. It's very low in Australia. Dr. Google isn't just the answer for all our questions. We need AOD education. Now, I get told schools should do a bit more. But it's not just schools. We need ongoing education in schools around AOD. We need it in our families. We need it in our community sporting clubs, which we do with Good Sports. We need it in a whole range of things. It needs to be there. We need to transition people out of school and into employment. Not easy. And we need to have fundamental changes to our economic policies. We really need to think differently, that it's not all about economics. It is about people and it's about the common good. So what can you do locally? Who's at risk of leaving school? Talk to your teachers. Find out more about your community. What's happening there? We want them to stay. There are programs out there that can transition people from secondary into TAFE or into New Start schemes and other schemes. What's the employment levels like in your community? Find those things out. What support is there for families, not just maternal and child health? A really big important thing is, are all your clubs in Good Sports? You know, we've got evidence to show we're reducing risky drinking by 37%. So why aren't all your clubs in a Good Sports program? And you need to start working in partnership with each other and other organisations around health literacy and around employment activities. And what activities are already occurring across your community in relation to these issues. So there's a bit of work for us to do around that. So I'd like to thank you very much.